Respect Professor Srinivasan for Pandit, and Anil is there, is entering there, and distinguished delegates. This is a monthly program going on for the past 5 years, and this is organized by the Division on Climate Change and the International Pediatric Association held in Geneva, and Dr. Parmesh Trust. Together we have been doing it. And this month program, this is the World Liver Day. So we have the environmental issues in managing liver disease. We are going to highlight that one, and we have a speaker to talk about it. Before we start the program, we like to pay homage to the departed souls in Kashmir. I request, let us stand 1 minute silence for this one. Thank you. The environmental pollution, in particular air pollution, and heavy metals, certain chemicals, pesticide, play a significant role in the development and progression of the serious liver disease, including liver cancer. Air particle less than 2 microns, they'll cross the 7 layers of the lung, enters the bloodstream, and get a small clots, small clots. They circulate all over. All the vital organ will be damaged. Liver is the one organ that receives everything, detoxifies, and helps us out a great deal. That we are talking about it. And also, we heard about that people do Ekadashi, fasting and all the things. It has got something to do with the scientifically. I think I went through that one. Intermittent fasting requires a chance of progression, reducing the progression of the advanced liver disease and hepatocellular carcinoma. This made me very happy to hear that on our traditional values, how it is Ekadashi are doing this one. Now for that we have it's another one, 52 diet. You heard about, sir? That is 5 days eat normal food every day. 2 days you diet. So that is 52 days liver disease. That's what is recommended scientifically nowadays. So these are all the issues are there. To talk this important subject, we have with us an eminent speaker. First of all, I thank my dear friend, Dr. Naresh Bhatt. He's the chief of gastroenterology there. They're all colleagues there. He's supposed to come, but this evening he's going abroad from conference in Hyderabad. He said one of the best person I've sent for much, you take him. So Yelsangikar is here. Amit Yelsangikar. His uncle is also a past president of Indian Academy of Pediatrics, Karnataka. We were very close friends, very close friends. And coming to this one, he did MBBS in Bangalore and MD in Chennai and DNB in Mumbai. And he's a senior consultant gastroenterology, GI oncology, and clinical nutrition, Aster Semi Hospital, Bangalore. And he has immense experience of 15 years in the gastroenterology and 13 years in GI oncology, gastrointestinal cancer. And so he's a senior resident gastroenterologist at DNB and Department of Digestive Diseases and Clinical Nutrition, Tata Memorial Hospital in Mumbai, where he has trained. And also Professor N. Madan Gopal, gold medalist in gastroenterology 2007, Government Stanley Medical College in Chennai. And fellowship in gastroenterology in the VOMC in Amsterdam, he did in 2013. And also clinical nutrition training in University of Leeds, United Kingdom in 2013, and he has organized many conferences and all this thing, and various gastroenterology organizations are member. He has a lot of scientific papers for his credit. Both are peer-reviewed journals, and it's a great pleasure extending invitation for him to highlight as environmental issues how best we can able to manage the liver disease. Thank you. Over to you, sir.
Thank you, Professor Parmesh. It's an honor to be in this August Institute amongst you and your students. I don't know if there is a concept of grand student, but if there was, then I would be your grand student because you are the teacher of my teacher. So keeping that in mind, I'm humbled in your presence, and I thank the various faculty that are present here for inviting me for this important talk and to be amongst your students experiencing this institute for the first time. I bring greetings from Aster CMI Hospital in Hebbal, and we are Department of Gastroenterology with one of the largest experience in the field of liver disease in our state. So when Professor Parmesh sent me the topic of environmental issues in liver disease management, it was a little intriguing for me. I wouldn't say that I knew everything about the topic. I wouldn't even say that I knew a lot about the topic. Probably I knew a little bit about the topic. So it has been a learning experience for me also while preparing for this talk. But suffice to say that what I have learned and understood is something that I already knew but didn't understand as well. And these issues are probably going to increase as the day goes on and as environmental issues and issues of climate change globally come to the fore. So liver disease, I think it's very important to start, first of all, since we are a mixed gathering, as to what does the liver actually do. And then we'll look at what are the common liver diseases, what are the etiologies, what causes these liver diseases, how does the environment influence this, and we'll touch upon this concept of the exposome. We'll look at what is the impact of climate change, that seems to be the need of the hour, and look at the other way around. How is healthcare impacting? I mean, everyone wants to know how is environment impacting healthcare, but what about the other side of the coin? How is healthcare systems? How are they impacting our environment? So, liver is probably the most important metabolic organ in the body. It is one of the largest organs. It has multiple important activities that goes on, including digestive processes, metabolic processes, toxic degeneration, and formation of various essential nutrients. So if we just look at some of the basic activities that happen in the liver, the most important is detoxification. So whatever enters our gut through the blood gets into the liver. So this can be nutrients, this can be toxins, this can be drugs, and all these are first metabolized in the liver. Liver also is the seat of production of important nutrients like cholesterol, vitamin D, vitamin A. It is the organ of storage of many of these nutrients. Also, the liver is important for energy metabolism. For example, glucose, fats, proteins, these are all absorbed through the gut, but these are all processed in the liver. So sugar that we consume is converted to fat in the liver. fat that we consume is converted to ketone bodies, and this is how liver takes care of energy metabolism. So if you have a liver disease, the first thing that happens is you feel low energy. So that is the reason why it is important to understand the role of liver in energy metabolism. Other things that the liver is important for is to act as a channel of removing toxins from the body. So for this, it synthesizes bile, and bile is the medium by which it excretes various toxins. Also, it is important for production of various proteins. Liver produces almost 90% of all the protein in the body. So, for example, albumin, clotting factors, various other proteins which are important for transporting various minerals. For example, iron and copper, these are transported. The transport proteins are synthesized in the liver. So patients who have liver disease can develop deficiencies or problems of these various essential micronutrients and trace elements. Liver is now being recognized as an important organ for immune function. So since it is the first pass, all nutrients, all organisms pass through the liver. So it forms the basic immune barrier against infection and also forms the site where inflammation starts. So now we are recognizing that the gut is the site for the microbiome, that is the billions of bacteria that reside within us. And there is an interaction between the gut and the liver which leads to either tempering of inflammatory processes or exacerbation of inflammatory processes. So coming to the various liver diseases that we see, there are some very common liver diseases. For example, infections of the liver, most common of which is the viral infections, the hepatitis A, B, C, E, and the other forms of hepatitis like the drug-induced liver injury, the acute liver failure, something that is a very serious form of acute liver injury. And sometimes we can get parasitic infections like liver abscess due to amoebic infection. Coming to the chronic forms of liver disease, we have chronic hepatitis, which can be again due to hepatitis viruses B and C, or it can be due to autoimmune processes, what we call as autoimmune liver disease. These, when they are present for a prolonged period of time, lead to irreversible liver injury, what we know as cirrhosis. And the complications of cirrhosis can be fairly devastating because this leads on to fairly severe form of liver failure and cancer. So these are the common liver diseases that we see in our practice. So what is the cause of these liver diseases? Liver diseases can be caused by environmental exposure, by genetic causes, due to toxins, or it could be due to autoimmune processes. A large proportion of liver disease that is seen in our country is due to environmental sources. For example, the most common of that is alcohol. So alcohol related liver disease forms a big chunk of our clinical practice. The other major cause of chronic liver disease in our country is now metabolic dysfunction associated steatotic liver disease, or what is called as MASLD. Previously, we used to call it NAFLD, that is non-alcoholic fatty liver, to differentiate it from the alcoholic liver disease. But now we know that it is not just that it is non-alcoholic, there is a metabolic dysfunction which causes fat accumulation in the liver. Amongst the other causes of liver disease, as I said, are the viral hepatitis, the autoimmune liver disease, various drugs, whether they are recreational drugs or prescription drugs or herbal medications, toxins, Something as simple as a herbal tea also can cause fairly severe form of liver disease. We have some genetic, some hereditary forms of liver disease which are involved in copper and iron metabolism, what is known as Wilson's disease and hemochromatosis. So this is an overview of the various etiologies that are responsible for causing liver problems. And as you can make out, a lot of these are influenced by the environment. Coming to alcohol-related liver disease, this is the major cause of chronic liver disease and cirrhosis worldwide. And alcohol can also be a co-conspirator or another insult in someone who has liver disease due to, say, MASL or due to viral hepatitis. So the so-called social drinking can also worsen liver disease if they already have an underlying liver problem. So it is not just that alcohol-related liver disease happens in those who drink heavily, even those who drink socially or uh, not so heavy drinkers can also have liver problems because they have another etiology of the liver problem. Of course, alcohol brings with a long history of socio-economic strife. There are problems due to alcohol. There are problems in the alcohol industry, which causes a lot of environmental problems. Alcohol industry is supposed to be one of the biggest carbon footprint industries in the world. They have, they are one of the biggest polluters in the world, along with the fossil fuel and the automobile industry. So there is an environmental aspect of alcohol which cannot be washed away. Alcoholism has a social aspect to it, but also increasingly we are recognizing that in this day of social media, that it is an addiction, that there is a genetic basis for this, and alcoholism itself is a disease. So not only does alcohol cause disease, but consumption of alcohol itself is determined not by a voluntary aspect, but there is a genetic basis for alcoholism. So that brings up a lot of socioeconomic issues, poverty, uh, unemployment, depression, anxiety. These are the social issues, the psychiatric problems that come with alcoholism. And we have to keep in mind all these things when we look at alcohol-related liver disease. So alcohol has many direct effects on the liver, and the environmental influence of alcohol related liver disease is huge. As I said, when you have climate change, when you have changing weather patterns, people are more likely to migrate from harsher weather conditions to uh, better weather conditions. For example, people may migrate from north to the south because the weather here is much better. And that brings overcrowding, that brings unemployment, and that brings with it these kind of substance abuse, especially alcoholism. And once you have these issues, the environmental influence on the liver problem is immense. The direct influence of alcohol, the environment on alcohol related liver disease is the extreme temperatures. For example, it's well known that in a place like Coorg, which has very low temperatures, people tend to drink a lot more than in other parts of the state. Especially brandy is quite commonly consumed in Coorg district. When the temperature is the other extreme, when it's a very hot season, when there's increased global warming and higher temperatures, people tend to consume more beer. And the alcohol consumption increases exponentially when you have extremes of temperature variation. So that is one of the direct effects of environment on the alcohol related liver disease. Of course, those who are having already an underlying liver disease, extreme heat or extreme cold can be quite disabling. heat shock, heat stress in a person who has liver disease is very poorly tolerated. They are very susceptible to dehydration, and that can worsen the liver problem. So these are the things that we have to be mindful of when we talk about the influence of the environment on alcohol related illness. Coming to viral hepatitis, the other big chunk of liver problems, it is quite intuitive that the two major foodborne viruses, that is hepatitis A and hepatitis E, are passed on through contaminated food and water. And it's a no-brainer that when you have climate change, when you have overcrowding, when resources are so small, especially water, which now we are realizing in Bangalore also, there is a challenge to safe drinking water. That is when these viruses raise their ugly head. When contaminated water and contaminated food is there, the viral hepatitis A and E tend to cause acute viral hepatitis. It tends to manifest as jaundice. There is illness for weeks, sometimes months together. It can cause loss of pay, absenteeism from work. It tends to impact their quality of life, but luckily there is no long-standing damage due to these acute viral hepatitis illnesses. So it is important that we look for answers to this question of safe drinking water and simple hygiene and sanitation, because this is mainly a sanitation issue when we talk about environmental challenges in liver problems. Also, now we have a very good vaccine that is available for hepatitis A, and use of this vaccine in children can prevent hepatitis A infection almost to the tune of 90 to 95%. Coming to hepatitis B and C, the transmission is different from hepatitis A and E. This is not a water or foodborne infection, but this comes from body fluids. So unsafe injection practices, blood transfusions, or from mother to child. Unfortunately, these are the viruses that cause chronic liver disease, can lead on to cirrhosis and liver cancer. Luckily, hepatitis B has now had a vaccine that is available for the last 25 years in our country. And again, the protection given by this vaccine is to the tune of 95% plus. Hepatitis C has a very good treatment, drug treatment, which can eradicate the virus. And hence, it is important that we try and make the country free of these viruses using this vaccination and treatment that is available. So how does the environment affect viral hepatitis? So as I said, that extreme weather patterns, migration, overcrowding, this brings with it the problems of food and waterborne diseases. There are always floods and droughts in our country. It happens every other year, and floods bring excess water, droughts bring no water. Both are dangerous, both bring waterborne diseases. When it comes to other more serious forms of liver disease like cirrhosis, liver cancer, whenever we have a calamity, whenever we have a event like the COVID-19 pandemic, healthcare delivery faces a lot of challenges. People who have these kind of liver problems require regular follow-up. They require regular medication. And whenever there is an event like this, whether it is an environmental event or a pandemic, these resources are challenged. And that is the impact, the real impact on these kind of chronic liver diseases. So as people who plan for the environmental influence, we have to plan for making healthcare more accessible and more available by using technology, whatever is available to us, and this is the way we can reduce the environmental impact in these chronic diseases. Coming to the metabolic dysfunction associated steatotic liver disease, this is the big epidemic now. The infections were the disease of the previous century. This century is the century of chronic diseases. And the biggest chronic disease that is now going to affect our country is obesity, is diabetes, heart disease, cardiovascular disease, strokes, and cancer. One of the things that links all these is what is known as metabolic syndrome. So metabolic syndrome is basically a disorder where there is insulin resistance, and once there is insulin resistance, body is not able to perform its metabolic functions. It starts depositing fat all over the body, and liver, being the center of metabolism, is the place where all this happens first. So fat deposited in the liver is so common. Almost 50% of all the people having health checks nowadays are having fatty liver. And unfortunately, fat in the liver is not an honest bystander. Fat in the liver over a period of time starts causing inflammation. It causes fibrosis. And once there is inflammation and fibrosis, the next step is cirrhosis. So advanced liver disease starts off with fat in the liver and ends up with more serious forms of liver problem like advanced liver cirrhosis and cancer. So MASL is now the leading cause for requiring a liver transplant in the US. What used to be hepatitis B and hepatitis C, now the scene has changed totally, and MASL is the reason for most liver transplants. In our country also, this situation is going to come soon. So it is important that we try and recognize what are the challenges in this field. Why is this the new epidemic? What are the reasons why obesity is exploding like this? What are the environmental challenges in this epidemic, and how are we going to make sustainable practices for this? So one of the keys apparently is in the gut. And what is now being recognized is that the microbiome is central to this metabolic problem, the metabolic dysfunction. And there is a constant crosstalk between the liver and the microbiome, which leads on to the metabolic dysfunction. So we have to look at how we can influence the microbiome and try and get hold of this problem and keep it under control. Some of the slides are. Yes. It has jumped some slides here. No. It's increasingly being recognized that metabolic dysfunction starts early in life. In fact, pediatric obesity is on the rise, and a lot of the fatty liver problems are starting of processed food, and the direct effect of this kind of sugar intake, processed food intake, is fat deposition in the liver. And now we have these various compounds. I'm sure all of you are aware of this. The alkyl, fluoroalkyl compounds and the aromatic compounds, which are there all over. They are finding these in our blood. They're finding it in utero, in the placental. Sorry. That fetuses are being exposed to these harmful compounds. And unfortunately, these compounds are not inert. They are leading on to oxidative stress, leading to inflammation, and they are causing metabolic dysfunction. So a lot of the pediatric obesity, pediatric fatty liver is directly linked to the environmental exposure in utero. And obviously this increases the risk of liver disease in the children. So as I said, metabolic syndrome is central to this problem. And we have all these things happening: the inflammation, the oxidative stress, insulin resistance, high blood glucose, adiposity, visceral fat, increasing visceral fat, high blood pressure. And look at all the causes that it is associated with, all the effects of metabolic syndrome. This is 90% of our clinical problems in the hospital today. Neurological conditions like stroke, polycystic ovarian disease, I'm sure many of you are aware, cancer, cardiovascular disease, diabetes, and fatty liver disease. So it's very important that we try and link this to what is really going into our mouths. So as there is increased processed food, as the trans fat increases, there is increase in fat deposition in the liver. The polyunsaturated fats are the ones which are the safest when it comes to fat consumption. Not just fat, it is also the sugar. Sugar is probably more dangerous than fat because sugar gets converted into fat. So fructose, a lot of people are interested in drinking juice, fruit juice, sugary drinks, soft drinks. All those have high fructose levels, and this directly gets converted to fat. High uric acid, diabetes, especially children. When we have children who drink a lot of these fructose containing drinks, you get obesity in children. And that is what leads on to metabolic syndrome. So the exposure to all these things happens very early in life. And the central issue is food. How is food now different from food, say 20, 30 years back? Food is different in its availability. What is available now is probably not so much whole food, it is probably more processed food. The economic challenges are there because whole food is probably more expensive, processed food is cheaper. So the lower socioeconomic strata, they are likely to consume more processed food. Unfortunately, those are the ones who are more likely to be affected by bad liver disease. Extreme weather changes. When you have a flooding, when you have fires, when you have global warming, the food supply chains are being affected. And that is again one of the most important ways that environment changes are affecting and causing problems with metabolic liver disease. As Sir mentioned, air pollution. There are these microparticles that are bypassing the lungs, getting into the blood, come to the liver and cause inflammation. And it is very important that we try and identify these and see how we can mitigate this risk. Obviously, global warming is the catchword nowadays. How is global warming increasing metabolic problems? If it's hot, what do you want to do? You want to stay at home. You don't want to go out. You don't want to exercise. You want to stay in air conditioned. You want to travel in an air conditioned car. What is the carbon footprint of these? It's huge. This increases obesity, decreases fatty liver disease. Coming to this exposome. What is the exposome? Exposome, it encompasses all the environmental exposures, right from conception till your death. That means all the environmental factors that you are being exposed to can influence health and disease. And this can be simple chemicals, whether they are in the food, whether they are in the water, what are the diets that you're consuming, stress, the lifestyle, and various pollutants. Even microorganisms are part of the exposome. And obviously there is a genetic basis for many diseases, but there is also an environmental influence. So not only is our genome responsible for these diseases, the exposome is responsible, and now we have the microbiome. So there is a sort of a crosstalk between all three, which leads on to these disorders. And when it comes to liver, the exposome is huge. Coffee, energy drinks, fructose containing drinks, alcohol, smoking, prescription medicines, even something as simple as paracetamol can have deleterious effect on the liver. Infections, stress, environmental toxins, processed food, allergens, all these are part of what we are exposed to, and all of them have an influence on the liver. Obviously, this is relevant because liver is the source of xenobiotic transformation. All the toxins which get into the body, whether it is through the diet, through the water, through air, it all comes to the liver for transformation. So liver forms the first barrier against all toxins, air pollutions, all these microparticles, radiation. Sir was discussing that water contains so much uranium. I'm sure all of that is going to affect the liver. So it is important to note that there is this gut-liver axis. So what we consume gets to the liver, and when it gets to the liver, there is some amount of inflammatory cytokines that are coming from the gut. And what is produced in the liver, the xenobiotics, goes back to the gut and has various deleterious effects. A simple example is arsenic. Arsenic is present in the water in many of the states, and arsenic is toxic to the liver. It has been demonstrated to cause liver fibrosis. There was a paper from PGI Chandigarh almost 40 years back. So one of the fastest growing cancers in India is now liver cancer. India used to be one of the lowest incidence of liver cancer in the world, say 20, 30 years back. But now the rate of increase of liver cancer has become exponential. And one of the reasons for that is this aflatoxin. Aflatoxin is produced by funguses. And where does it come from? It affects mainly peanuts. It affects grains, which are improperly stored. And this aflatoxin is a WHO certified carcinogen. It is known to cause liver cancer. So why is it important for us who are talking about the environment? Aflatoxin comes from funguses, and funguses thrive in warm climates. So once you have an environmental change, a shift towards warmer climates, the incidence of funguses affecting the grains and the peanuts is high, and the production of these carcinogens becomes very high. There are various drugs which are known to cause liver toxicity, including prescription drugs, including various other herbal drugs. This is one of those. So this is in the Middle East. Like we have betel leaf chewing. The Middle Easterners, they chew this khat. It's like a betel leaf. It is a recreational chewing. And that is known to cause liver disease. So there are these compounds in what we think is natural. Everyone talks about this is natural, that is natural, natural is good, herbal is better. But we have to understand that a lot of these natural products have dangerous alkaloids. They have dangerous chemicals, which are toxic to various organs, and liver is one of the organs which is affected by these toxics. So there is a fad for all that is herbal and natural. I'm sure you would have seen a lot of advertisements. Everything, including the toothpaste to the soap to the shampoo, everything comes with it a herbal or a natural, brand or advertisement. So just because something is herbal or natural does not mean it's safe. Obviously, none of these are tested. Once there is no trial, we are at the mercy of what is put in them. And almost all of these advertised claims, there is absolutely no evidence for this. So we have to be very careful when we look at these herbal or so-called natural drugs. So one of the things that as lay people are told whenever they have a liver problem is, oh, there is no treatment in allopathy, you have to take some herbal remedies for this. That is one of the most dangerous advice that someone can give a person who has a liver disease. These herbal medicines for liver, A, may not be useful at all, or B, they might be quite toxic. So these milk thistle, phyllanthus, these are harmless. There's absolutely no use. Many of them prescribe this, but these are of no use at all. But there are some of these herbal extracts which are dangerous, not just not useful, dangerous. This giloy, I'm sure many of you saw this Times of India expose during COVID. A lot of people were chewing this giloy, thinking that it may improve their immunity, and it led to almost 50 cases of severe liver disease and liver failure. So we have to be very careful. Ashwagandha is something that is, I think, time immemorial. People have been talking that it's put in chavan prash and jadi booty and all sorts of things. These are all toxic things. To be very careful. Herbal teas. Everyone wants to drink a herbal tea in the morning. They think that it gets rid of fat. There is no scientific basis for this, but herbal teas sometimes contain alkaloids which can cause this very severe liver problem called veno-occlusive disease. So we have to be very careful when we market these kind of things. The risk is quite severe. As the import of Chinese goods comes into India, there are multiple Chinese herbal products also coming in, and many of them are toxic to the liver. And they also contain heavy metals. So many of these traditional or complementary medicines, whether it is Unani, Siddha, they contain toxic lead, cadmium, arsenic, mercury. These are all heavy metals, and they are directly toxic either to the liver or the kidney. So coming to the microbiome is the entirety of all the microorganisms that lives in our gut. It is an organism by itself. The entire microbiome is an organism by itself. It eats what it wants. It produces various nutrients. It produces various cytokines. It is essential for us. It is also deleterious for us. So anything that influences the microbiome can influence our health and disease. And one of the most important influences on the microbiome is environmental. It is our diet. It is the medicines that we take. So a lot of our diseases nowadays are linked back to the microbiome and hence linked back to the environmental exposures. So whether it is metabolic dysfunction, whether it is immune related disease, autoimmune disease, or whether it is cancer, can all be traced back to dysfunction of the microbiome, what is known as dysbiosis. So what we eat influences the microbiome, the good bacteria, bad bacteria, the proportion of the good and the bad bacteria can be influenced by various things, including the diet. If you feel that you want to eat more sugar today, it is not that you are feeling, it is the microbiome that is making you feel that you want to eat more sugar. So that is the influence of the microbiome. So it's very important to understand that those in the lower socioeconomic strata, for example, an African country like Burkina Faso has a different microbiome as compared to those who stay in a more developed country like Italy. And this is basically because of high processed food intake, and here it is due to the Mediterranean diet. So the socio-economic status of a person, of a community, of a country also influences the kind of microbiome that is there. And because of this, polyunsaturated fats are good effect. Those who consume more processed food, more sugars, more saturated fats are. So this is one point that I will come to in the end, because this is something that I am holding our community responsible. Not only is environment affecting healthcare, healthcare also in whatever way that, and the carbon footprint 3 times that of commercial units. For example, if you have a commercial building and you have a hospital produces 3 times more carbon dioxide compared to the healthcare. Also, there is more power consumption. There is hardly any solar power generation in hospitals. It is all fossil fuels. Hospital employs people who commute from their houses to the hospital and back. There is no work from home, so that carbon footprint is huge. Energy consumption and production of bio waste. We are some of the biggest polluters when it comes to all these things. Hospitals use various accessories, plastic, gloves are not reusable, and this produces a lot of waste. And it is important that we try and bring out in such forum some sustainable technology, some ways that we can reduce our carbon footprint. It's important to understand that most liver disease is preventable. As we discussed, there are vaccines for hepatitis A and hepatitis B. There is very good treatment for hepatitis C. If we have clean sanitation, clean water, clean food, hepatitis A and D can be prevented in a large extent. Alcohol, improving people's socioeconomic status, improving their psychiatric status, improving status, improving food availability, improving access to maintain a good healthy lifestyle, exercise, and improving the environmental exposure around us. All that will improve the exposure for liver problems. So my message today is that in the 21st century, we are increasingly seeing more and more liver diseases, and many of these are preventable. Environment and climate change is influencing all forms of life, and liver disease is no different. It is also being influenced. Probably in the coming few years, we will get on to manipulation of the gut microbiome as the next frontier to manage these problems of chronic diseases, obesity, metabolic syndrome, and liver disease. And as a society, we have to look at sustainable healthcare practices. This is the need for the hour. Thank you.
Few questions?
Sure.
Absolutely. Few questions? Anybody?
What kind of medications can cause that liver diseases? Example, Lexapro tablets, regular T tablets, and others.
Very good question. So there are more than, say, 100 medicines that can cause serious liver problems. In fact, now they have a website called Liver Talks, which gives you the list of all the medicines that causes liver disease. But in common clinical practice, the ones that can cause serious liver problems are antibiotics, commonly used antibiotics like Augmentin, that is used for infections of the ear, nose, throat, that can cause serious liver problems. As you said, anti-epileptic drugs can cause liver problems. Anti-tubercular therapy can cause liver problems. Painkillers, simple painkillers, what we call as non-steroidal anti-inflammatory drugs like ibuprofen, diclofenac. These are again drugs that can cause serious liver injury.
If you are taking a temporary period, okay, lifelong period if they are taking.
So there are different forms of liver injury. There are some which are dose dependent. That means how and how many, what is the amount of medicine that you take. Then there is something called dose independent, which is an allergic reaction. So even one dose can cause that. So that is something that is not predictable unless you've had a previous allergy. That's all. But something that is dose dependent, obviously, the longer you take something, the more likely that it is going to cause. Drug-induced liver injury is most of the time reversible. There are some forms of irreversible drug-induced liver injury, like one drug for arthritis that is given is called methotrexate that causes liver fibrosis. So obviously that is not reversible.
I think I have to add one thing here. When in the United States, a child came with a fever, mother has to give paracetamol. So every hour she went on giving 24 hours from the clock. This child got acute hepatic failure, child died. I think this some occasions will be there. And you all agree he covered so beautifully. And also, few points he made, I think hepatitis B vaccine. I think in 1987, we invited Professor Bloomberg. He has been found out the hepatitis B vaccine. We made him to stay in the Institute of Science guest house only here. And he's a Nobel laureate. And he addressed our people and the faculty in the lakeside. Then I arranged a dinner in Holiday Inn was there. But he said his wife and himself came, Parmesh, could you take us to the golf clubs, Bangalore Golf Club? I said, all right, sir. I went there and I saw and all this thing. We had dinner and came back. And while dropping my, why you wanted to Bangalore Golf Club? It is the oldest, no doubt it's the oldest club in India. Why it is? He said, because one of my contemporary was a captain of that one. How it is, I want to see it. I didn't know who the Sir Ronald Ross, who founded malaria parasite, was a member of that captain. That's what we mentioned about it. Second thing, you also mentioned environmental issues have an impact from womb to tomb. We covered everything. And also genetics is a brick and mortar. Environment is an architect, brings out the disease. And also third, you mentioned herbal tea. Herbal tea, next to water, it is second most to drink. All over the world, people drink. That you highlighted very well. Everybody think herbal drink. I think you highlighted that one very well. And also hospital-related issue, we produce carbon footprint. We did a study from Vellore, myself and other people. We presented that in the textbook you have written. Hospital produces 4% of the carbon footprint. And the predominant department is anesthesia department. Next is the your department is a little less anyway, but it does contribute hospital. We have to highlight this one for the hospital to make that one. Food related issue, this one. I think This week, India today, junk food epidemics has come there. What is the magnitude of that? This morning I was talking to you, sir. This is written by Purnima Menon from the Director of Food and Nutrition Policy. That ultra-processed food, the drinks in India, nearly every year since 2011 to 2020, every year it goes by 13.37%, every year increasing. Every year. What is the economic burden of that one? In 2011, it was 4,077 crores. In 2021, 2.67 lakh crores. This is the business. Why it's happening? Which is the major component of that one? Junk food, chocolate, 35%. Cream, biscuits, 17%. Cereals, what we have been started using here, 16%. Carbonated soft drinks, 14%. And instant noodles, 7%. Salty snacks, 6%. Why it has come to this one? Food choices, how it is developed? Family dynamics changed. Women putting the table on the table. That we have to focus on that one. Socio-economic, we did mention about it. And convenience for the people. And accessibility, availability, affordability, and power of marketing. They have had. These are all the issues are there. And you covered very well, and we are thankful. On behalf of our organization, we request have a small token of appreciation memento. Professor Srinivasan, sir, would be able to hand it over. Come. All of you will have a photo after this, and thank you very much. So let's have a photo. Change the second.